to go to the different farmers markets you have in Monterey on different days of the week, and also the one in Pacific Grove, the Monday farmers market in PG. Are the farmers markets operating?
Monty Shopping Center is on Fridays from 9 a.m. to 2 p.m. But I think if you got there before 9 o'clock,
it appears from reports.
Campaign messages are absolutely appropriate. Don't delay care, don't die of doubt. You need to know what is happening.
Against protesters, which they say contradicts Chief Newsom's assertion that the day the president moved to St. John's Church, MPD did not participate in that move, did not deploy munitions.
Where was the video from?
ACLU just released it.
But where was it?
This
What did it? Where did it show? It was at Lafayette Square.
It was, yes, yes.
Okay, I'll have to look at that. I'm not familiar with that video.
Have you gotten any updates that would make it clear to you whether or not what DC MPD's role was that day, that in fact that maybe they did participate in helping the president make that move?
No, I have not gotten anything that would suggest that. Yes.
Yes, I have a question for Dr. Robinson. Dr. Robinson, there are some in the community who believe that the way you get a heart attack is through two modes. Number one, you're too old, and number two, you work too hard. And with those type of perceptions, what is the best way for a district resident not to get a heart attack during the COVID-19 period?
Well, that's certainly a myth, because I have patients that are unemployed that have heart attacks and that aren't as stressed out, and people that are in their 30s. So certainly you want to look at the major risk factors that are common in most of our cities, especially in major urban areas. Diabetes, hypertension, high cholesterol. Those are sort of like the tip of the iceberg when you think about the risk factors that contribute to a heart attack, but there's a bigger issue we call health equity and the social determinants of health. So transportation, housing, security, policing, all those factors play a role in precipitating cardiovascular disease and other chronic conditions. So we can't look at just one particular factor and say you should go out and walk more or you should live in a better neighborhood, because we know that can't happen. There are people that are in environments that they don't feel safe going out for a walk, or there may be a liquor store, a couple of buses to get to a good grocery store. So it's not that simple when you talk about putting a cookie cutter mechanism to help decrease those risks of strokes, heart attacks. You can play a role in being more active, certainly. You can play a role with watching the kind of diet that you have. And it's not always more expensive to eat healthier when it comes to that factor. So it's a community, it's a group effort that will have to help as I said, policing, housing, transportation, food securities or food insecurities that'll have to play a role in helping to reduce that.
And let me just say this is that in like a year's time, I had lost 3 people in my circle to heart disease or heart attack who were all less than 50 and in a couple cases in their early 40s. And one was a woman. And so I just want to, at that point in time, for everybody that I knew, I always asked them the question, have you had a checkup? How's your blood pressure? Are you taking your medicine? Also, all of those things I think are huge myths. Young people drop dead of heart attacks, sudden death all the time. And we have to definitely dispel the myths of only being elderly and only being a man or only being this or that, to pay attention to your heart health and managing chronic illness.
If you go into any dialysis center in the city, you'll see younger African American men and women in some of those dialysis centers, and some of the complications are from diabetes and hypertension.
Okay, thank you very much, everybody.
Well, Governor Gretchen Whitmer says she'll roll back reopenings of coronavirus cases continue to rise. And one thing she doesn't want to see is hospitals and healthcare workers getting overloaded once again. So this morning, the doctor's in, and joining us this morning, Dr. Rena Deza, family medicine with Henry Ford Health System. Dr. Deza, thank you for being with us. It's been quite a journey. You were really working on the front lines back in April. Tell us what it's like now at the hospital system.
Well, good morning, Dina. Thanks again for having me. I'm back in my clinic right now. I know I was deployed to the hospital for a good 6 weeks or so doing inpatient work, doing ER work. But now back in the clinic, we're seeing patients coming back in for their chronic conditions, seeing sick visits. We're still doing a lot of virtual visits, which is very helpful for patients who are acutely ill.
I want to talk about the numbers because that is what we get every day. We get a new total of people who are infected. We get a death toll every day, and the numbers are going down for the most part, at least here in Michigan. Do we take comfort from that? Do we say, okay, we beat this, we can go and live our lives now? Explain those numbers to us.
This is definitely not the time to let our guard down. We have worked so hard to remain socially distant. We closed down our economy. This was all to control that massive surge that we had here in Michigan. And so definitely not the time to let our guard down. We still want to wear masks in public. We still want to remain socially distant. I know things are opening up and it's summertime and we want to get out there. Be smart about it. Make sure that you're remaining 6 feet apart. If you're ill, stay home.
Let's talk about wearing masks. And we know that being outside, doctor, there is some UV protection that comes from the sun when it comes to that virus, and there's some ventilation. Describe the importance of wearing masks and where you should wear them.
No, Dina, it's really the simplest thing we can do to help prevent the spread of this virus. One projection said that 33,000 deaths could be prevented by October if 95% of people wear masks in public. So those numbers are pretty remarkable. A very simple thing that we can all do to help prevent that transmission and spread of the virus.
This is allergy season, and a lot of people have a cough and perhaps maybe sometimes a fever when it comes to allergies. And that can be similar to COVID-19 symptoms. How do people discern what they're going through?
Yeah, definitely. We are seeing a lot of allergy flares in our clinic, and some of the symptoms do overlap. So, reminder, the symptoms of COVID, cough, shortness of breath, fever, but you can also get a cough with allergies. You can also have a runny nose, a sore throat. So how do you know what's what? Well, the simplest thing you can do is take your allergy medicine and see if it gets better. And if it does, then maybe it was just allergies. But you can always reach out to your healthcare provider, and we are more than happy to talk through your symptoms and decide whether or not you should be tested for COVID-19.
I want to ask you about the flu shot, and we know that science is working very quickly to try and come up with a COVID-19 shot. Every year with the flu shot, doctor, as you know, about half of Americans don't want to get it. What's the message this year?
Definitely, please get it. We get our first batch of flu shots probably at the end of August, and